What we need now is that you try those, your bite, the function, how you clean, all that, okay? So if everything is good, we can proceed with the same design for the final restoration. Okay. I already noticed a couple of things that I want to change because when I placed it, I don't know, midline, this and that, so I'm already planning to do some minor adjustments on the design, but I need your feedback after you use it for a couple of weeks.
Which is a point I wanted to share with our viewers, is that this is not just the doctor doing all the work. This is the patient has a role to play in the success of this.
Yes.
Not just the hygiene, which is very important, not just eating properly, meaning
taking care of it.
Yeah, taking care of it, but also taking good notes to give you guys feedback. So what are some things? You said bite. I'm going to want to pay attention to bite.
Yes.
What else do I want to pay attention to?
Okay, to the bite, to the food packing, for example.
Okay, the food that goes up underneath.
Yes, underneath.
Happen a lot. Okay.
And that happens much more usually with the upper hybrids, okay? So that's why we need to be like the design should be easy to clean and trying to avoid as much as possible the food packing, okay? So it's like a balance. So now you will give me your feedback based on that.
Okay.
Okay, the bite. If you have any pain with your bite and this and that, that's of course pain or any kind of symptom you should tell me.
Okay.
The aesthetics, the length, the speech.
Speech, okay.
Not in your case because you had all your teeth. All the implants were loaded, so we don't have big changes, okay? Mm-hmm. But with other patients, sometimes we add more teeth in the back, we increase the length of the teeth, and we do changes that may modify the speech, for example. Okay. So I need to know that. Okay. Then the space in between, if the air is passing through, your speech will be different because you will start like whispering like, okay?
Okay.
So I need to know those things.
Sure.
And of course, every time we do changes in your mouth, you will have, your tissues like, what is this, Of course. So if you tell me right now, you will have a lot of concerns. But if you try those teeth for 5 to 7 days, your tissue, your tongue will get used to that new position and your speech may be the same again, like normal. So no issues. That's why we need to try it not for 5 minutes, we need to try it for a couple of weeks. So you need to get used to the new position of your teeth.
Okay.
You may bite yourself. Not in your case because you already had all your teeth, but most of the cases that we add teeth, your tongue during the healing process and your cheek, that both of them will contain food so you can chew. Now they have teeth again in that area. During the 4 months, 6 months, they were using, the tongue and the cheek were using that empty space and they were like muscles, okay? Suddenly you have teeth back and your tongue will try to go there and you will feel weird for the first couple of days. And you may bite yourself until your brain connects the new position and says, no, this is your position, this is your position, this is the teeth position, okay? So basically, that type of feedback is the one we're looking for in the second appointment, on the next appointment.
Perfect.
Okay?